Hello, my name is Lily and I am a parent advocate with LINKS CPRC. This presentation will explain what related services are under special education law, why they matter, how they support students, and how a student can receive them. Under the Individuals with Disabilities Education Act, IDEA, eligible students must receive a free and appropriate public education, FAPE. This includes special education and related services. Related services ensure that students with disabilities get the support they need so that they can access the general education curriculum and participate in school activities. These services help remove barriers, for example, speech or mobility difficulties, so that a student's disability does not prevent them from learning, participating, or making progress. Related services are defined as transportation and such developmental, corrective, and other supportive services required for a child with a disability to benefit from special education. This definition covers many different kinds of support beyond academic instruction, depending on the child's needs. Think of related services as extra help a child might need so that they can fully access their education, help with learning, movement, speech, health, and more. When an IEP team determines a student's needs and related services, those services are provided at no cost to the family. These services are part of the school's commitment under IDEA to provide free and appropriate public education. Families should know that if the IEP includes these services, the schools must provide them without charging parents. Not all students need every related service. Each IEP is tailored to the student's unique needs. The IEP team can review and adjust services as the student's needs change over time. Related services are not a one-size-fits-all. They evolve based off the child's progress, growth, and challenges. Some examples of related services are speech and language pathology and audiological services, occupational therapy and physical therapy, psychological services and counseling services, including rehabilitation counseling. These services support students with a range of needs, from communication and hearing to motor skills and emotional behavioral support. Additional related services may include interpreting services, for example, for deaf or hard of hearing students, orientation or mobility services for students with vision impairment, early identification and assessment of disabilities, helping detect early so supports can be given as soon as possible. The scope of related services is broad, from helping a student navigate spaces if they're visually impaired to ensuring early help if disabilities are suspected. Other supports include school health services and services from a school nurse, recreational services, including therapeutic recreation when needed for physical, social, and emotional support, social work services in schools, and parent counseling or training to help families support their child's needs. As a family, health care access, social support, and even school-based recreation can all be part of what helps a child thrive. But who decides what services a student gets? In short, the IEP team. A student's IEP must list any special education and related services they will receive. So the IEP team, including parents, regular and special education teachers, and other specialists, determine what services may be needed. Related services are based off the child's individual need. Not every student will get every service. The team looks at evaluations, observations, and parental input to decide what supports are necessary for that specific child. Anyone on the team during an IEP meeting can give their input and suggest a service. For each related service included in the IEP, the document must specify when the service starts, how often they will be provided, and where the service will take place. Details matter. When, where, and how often a child gets the service help ensure consistency and clarity for both school staff and families. There are a couple ways students can get connected to related services. Under IDEA, each state must have a system, often called Child Find, to identify, locate, and evaluate young children, often below elementary age, who may need special education and related services. For elementary age children or older, parents or school personnel can refer a child for evaluation if they suspect a disability. Once evaluation shows a child has a disability and needs support, the IEP team meets to determine what related services that child should receive. Getting services usually begins with noticing a need, then doing a full evaluation. That's how a student becomes eligible for special education and any needed related services. Who provides related services? Related services are provided by qualified professionals, such as speech-language pathologist and audiologist for speech and hearing, occupational therapist and physical therapist for motor, mobility, and daily living skills, school psychologists, counselors, and social workers for emotional, mental health, and social support, school nurse or health staff for medical health support, interpreters or orientation and mobility specialists for hearing or vision support. The right kind of support depends on the needs of the student. That's why the IEP team includes different types of professionals. As a parent or guardian, it is important to ask about what related services might support your child's needs: therapy, health, communication, mobility. Make sure the IEP clearly states what services your child will get. What, when, how often, where, and by whom. Understand the services listed in the IEP must be provided free of charge. Recognize that the needs can change. Stay involved and request reviews if needed. Your voice matters. Being informed and involved helps make sure your child gets the right support. To summarize, related services are supports beyond academic instruction required under IDEA when a child's disability affects their access to education. Services cover a wide range: speech, therapy, health, mobility, social work, interpreting, and more. The IEP team, including the parent, decides what services are needed, and the IEP must specify the details. Services are provided at no cost and are customized to each child's needs. Parents play a central role in identifying needs, requesting evaluations, and shaping the IEP. Related services are essential tools that help students with disabilities succeed academically, socially, and emotionally. The families and schools work together to create the best plan. Thank you for listening. If you need any help or assistance with anything in the special education realm, please reach out to LINKS CPRC in the Mat-Su.